Hello and welcome to the Bee Formless Flow Driven CEO podcast. Today I welcome from Atlanta in the USA, Shelley Saxena, who is the founder and CEO of Sevamob, which is a healthcare company started back in 2014-15, which transforming primary care delivery through mobile clinics, telehealth, and AI-led strategies. Starting in two towns in India, and I cannot wait to hear the backstory to this, Shelley, with a B2C model. Sevamob pivoted to B2B services to scale and then added telemedicine and specialized services in vision, nutrition, cardiometabolic, and infectious disease. And today, Sevamob operates across India and Bangladesh, but you've also done pilots in I think you said South Africa and the US and serving millions and partnering with global health organizations. I should also add that every quarter you travel to India into across multiple cities in India, but Atlanta is your base. Tell us about your journey, Shelley. It sounds quite fascinating in terms of where you've
Well,
started, where the business is now.
Belinda, thanks for having me on your podcast.
You're welcome.
I am originally from India, and I did my bachelor's from Indian Institute of Technology. And then I came to the US and worked at IBM in product development. Then I went off to get my MBA from Cornell and came back to do product management channels and go-to-market work in IBM. And then an episode with my mom, where she was incorrectly diagnosed and almost lost her life led me to start a primary healthcare service in India in two towns near my home city. And the learning was that if this could happen to my mom when she was based in a tier two city, the situation in tier three and rural was even worse. And so we started as a B2C service offering primary healthcare subscriptions to families in rural on roughly $2 per month model. And very quickly we realized that a B2C model would not scale and would take a lot of time to be sustainable. And to be switched to a B2B model where we started offering this service to employers and to schools. And that's how we achieved unit economics. And then in order to improve our margins and improve our overall sustainability, we split a service into multiple specialties like general health and vision and nutrition and cardiometabolic and infectious disease. And that improved our gross margins, that improved our patient engagement rates,
Wow.
patient renewal rates, and so on. And then one thing led to another. Our customers, so initially it was a mobile clinic-led model. And then our customers asked us for access to care even when our on-site teams were not there. And so we added telehealth to provide that access. And while we do support video consults and second opinion, most of our telehealth access is actually by a regular phone-based calls, just because of our patient base, which is mostly in tier three and rural, even though we do serve tier one and tier two. And then 4 years ago, we started dabbling with AI, and that was because of specific customer requirements. So, for example, in the low-income populations in developing countries, malnutrition is a key issue. Almost
Yeah,
as
right.
many as 40% of the women are malnourished, right, in that setting. And so dietitians were hard to come by. When they were available, they were expensive. And the quality of counseling from one dietitian to another varied quite a bit. So we developed our diet AI, which could enable a nurse to do diet planning and predict multivitamin and mineral deficiencies. And that was our first module. Another module was TB and so on. And we added, and today we are at 8 different modules in AI. And that's how we are at where we are today, where we provide AI assisted disease management to organizations on a B2B model. We are serving 20 plus states of India. We are also working in Bangladesh. We have done pilots in South Africa, Lesotho, and in the state of Georgia in the US.
Wow, what a story. What a story, Shelley. It's quite incredible. Like you're just like it's just going and going and listening to you and the pivoting. You called out a couple of things that I just want to understand in a little bit more detail, but you said 40% of women are malnourished in, I think you mentioned, was it Bangladesh or India? You said,
Most of these developing countries, whether it's India, but my statistics was from India specifically.
and why women? Why 40% women? Is that because they're feeding their families, they're giving more to their families? Like, why were they so like? Why is that stat so high for women being malnourished? Out of interest.
So first of all, it depends upon income level. In that low income like no scenario, and the access to awareness is less, and the access to different food groups and nutritious food groups is less or not affordable. And just like women prioritize their family members
Yeah, so
first, right? And then like it's them, right? So it's all of those factors. And the thing about malnutrition is it's very cyclical. So, for example, a mother who has a low birth weight baby is more likely, that baby is more likely to grow up into an adolescent, which is like, anemic or malnourished, right?
uh,
That adolescent is more likely to then become a woman who is malnourished, right? That
yeah,
woman will then give birth to a malnourished baby, and this life cycle, this
cycle.
continues.
Yeah.
Yeah.
It's fascinating. And then you talked about AI. You hit AI 4 years ago. So you were ahead of schedule in terms of, I mean, obviously AI has been around since what, the 1950s or 60s. How did you and your business just like 4 years ago, like what was it? Was there a trend? What did you see that like you were almost like a frontier in bringing AI into your business? I mean, it's obviously it's a big buzzword at the moment in 2025, but 4 years ago it wasn't really, it was kind of very dormant, wasn't it? So how did you get into AI? How did you bring that into your business? That was obviously a big part of pivoting.
Sure. So it was almost back in 2019, and that was before generative AI and foundation models. We started very early when the simple machine learning and TensorFlow based models were available. And there were different customer use cases. The first one I mentioned to you was the malnourished,
Yeah.
ability for the nurses to then provide the same level of diet counseling which a dietitian can provide. Another requirement was in India there's a government program to eliminate TB. But there are not good technologies available for mass screenings for tuberculosis. Molecular testing is expensive and cannot be used in a mass setting. And the existing other options are not accurate or take too much time. And so that's why we developed our sputum AI, which could enable a nurse to screen for TB in sputum samples. Then another requirement we had was the physicians are expensive. And while they are readily available in India, in other countries where we operated, the physicians were not as readily available. We had to work with nurses and nurse practitioners. And so, in using AI, we developed our symptoms AI, which enables a nurse to do a physician level triage for that first touch point with the patient, right? So that was our next module. Then we developed our blood AI, which screens for anemia in blood samples. We developed vision AI, which screens for diabetic retinopathy in fundus images. We then recently developed our medical evaluation AI, which, based upon an entire medical record, assigns a health score and then makes recommendations on what you should do next. And so we use it often in employee health scenarios.
Yeah.
Then we recently also launched, just this week, a lab report AI, and that analyzes your lab report and summarizes it for you in human, understandable terms, simple terms, and then suggests on what you should do next based upon that lab report. We developed a chest X-ray AI, which screens your X-ray images to screen for tuberculosis in chest, X-rays, right?
Wow.
So all of these were based upon specific scenarios that we were seeing in our primary healthcare service, and then we had to find a cost-effective solution to address those specific concerns, and that's how and why we used AI in
Yeah,
different
right.
scenarios.
And tell me, how big's your team? Like, how big's your team? Like, is it small? Is it large? Like, how big is your team across the business?
So full time we have 159 people, out of which roughly 15 to 20 are back office and R&D team, and then the rest are medical teams deployed full time, and then we have 300 contract based staff whom we pay
Wow.
on a per day basis. So when we talk about a medical team means a MBBS doctor and a nurse and a data collection person slash coordinator. And so roughly today we have 40 plus full-time doctors on our payroll, 40 plus full-time nurses on our payroll, and so on. And then that's like, augmented with 100 plus like, physicians, 100 plus nurses, and so on, whom like we have on contract basis.
How do you, so you talked to, when you booked in to do the podcast, I asked the question around what's one unique insight or experience when it comes to life, leadership, or business. And you said in business and life, pivoting is key. You talk
Yeah.
about your business model and the growth, but also the power of the pivot. You've also got a massive team. Tell us a little bit about your insight around, in business and life, pivoting is key.
So almost never will you start with a business case and stick to the business case from the start to like, exit, right? The market conditions change. Your assumptions that you made about the market or your customers' paying capacity or something else do not hold. Your investors might give you different feedback. The government regulations might change, and the overall technology environment might change. So you have to adapt. If you don't adapt, you'll be dead like in a year or
Yeah.
less than that, right? And so in a business setting, that adaptation is very crucial. And then same way in the personal setting also, I was totally on the tech side. And then making the jump from tech to healthcare based upon like personal experience, that was a pivot for me. That meant I had a loss of like I did not earn the same as I was making before I made the pivot, right? But I was getting more satisfaction from what I was doing after the pivot. So there are always trade-offs, and there are like changes in conditions which you have to adapt to.
Yeah, which also gives you that like resilience and that growth, right? Like in terms of you even talking about your tech to healthcare, obviously you had a profound lived experience with your mum, being unwell the way she was, and then and no doubt that influenced you to move into healthcare. The pivoting at times is like can be so difficult in terms of you want to pivot, but there's also then this fear, and then there's this kind of holding you back. Have you ever had any moments in the business where you're like, you need to pivot, you need to move in a different direction, and yet there's been
Yeah,
this
and
almost like this resistance to change, or there's resistance or the fear of it. What if it doesn't work? But what if it does? Does that make sense?
Absolutely. And there is always, I would say, the status quo has its own momentum, and to change direction and to do something different, try something different, is always like hard. You have to, it's not just you who has to change, your entire team has to turn around. They have to understand why you are pivoting, why you are changing, the objectives and the priorities, all the way from the top of the team down, all the way down to the bottom, has to like change accordingly, right? So I would say it's a full organization change which is needed, and which is always very hard because every organization, no matter big or small, has its own momentum. I'll give you another example of pivoting. So when we entered South Africa, we entered via a franchisee, and we had challenges around transparency. We had challenges around how fast that organization could move, and so we switched from a franchisee model to a direct model. But when we moved to a direct model where we were like not directly like offering the like service there, then what we ran into were all types of compliance and issues which did not have anything to do with the core model that we wanted to offer, the core service we had to offer. There were just too many different types of labor laws and other compliances and so on in South Africa, which were bogging us down. And so we switched again. We switched to a model where which was led more like a reseller, led model. And what we decided at that point was whenever we enter a new country, is going to be via a local partner to whom we will offer a bundle of services or
Yeah.
offerings. That bundle would include our technology platform. It would include third-party rapid kits for point-of-care testing, and it would include a panel of telehealth specialists for second opinion and video consults, which they can use. And that would be our offering in a new market rather than trying to implement the entire model ourselves like there or implementing our model like through a franchisee. So as you would see from this example, you have to test, you have to pivot, you have to
Yeah,
see what
iterate.
makes sense in a context.
Yeah, it sounds like you're very calculated in terms of in the best possible way. Like you're very clear when you need to pivot and when you stay still, for example. Question for you, you're a CEO and a founder. What do you think is required in a CEO and founder in today's world, as we're obviously in this, we're moving in more and more into this new world order. You're at the forefront of healthcare, tech, etc. What do you see as the key personality, the key traits of a successful CEO founder these days? Like, what do you believe it is?
So
Excuse
I
me.
would say, first of all, at the simplest level, CEO is a HR manager, right?
Is it what,
And
sorry?
human resources manager,
Yeah.
and right. So he or she has to hire the right team. He has to set the right goals for the team. He has to set the proper evaluation metrics for each member of that team, and then he has to empower that team to go and execute and not micromanage. Right?
Yeah.
Oftentimes, you would see CEOs who micromanage and not let the team operate to its full potential. On the other hand, there are also CEOs who are like too, I would say, who are not who don't understand the details. And that's also, as a startup, like, founder, that also does not work. So you have to have the right balance. So that's first, like, be a good HR manager. The second is you have to have the right vision. And the third is you have to have the ability to explain that vision to your investors, to your customers, to your team, to everybody in the entire, like, chain, right? And the third is the ability to execute and have the relationships. Now, there is no person on this planet who has all of these three or four skill set in a single person, right? It's not possible. So you have to then find out what's your strength and what's your weakness, and you have to pair yourself with the right people who can complement you and address the gaps which are there in your personality.
Yeah, I love that because you're only as good as what's something in my throat. You're only as good as your team around you, right? Like, like
Exactly.
that classic saying of hire better than you, hire talent that are better than you. But it's like lose the ego because they're not going to take your job. It's just ensuring that you've got the right skills, the right people around you. Are there ever, as a founder, as a CEO, this is your baby. This is was your business. You created it. You started it. Have you ever had moments where you've struggled to let go, like in terms of, the baby's growing up, it's grown up, it's 10 years young. It's still in its infancy in a way, and it's continuing. But have you ever had moments where, and I'm asking you probably if it's a vulnerable question here, where you're just like, oh, I don't know if I can, like, you know what I mean? Like I've had moments where it's like in the past where it's like, I need to let go. I know I need to let go, but I've birthed this baby. Like, you know what I mean? Like, yeah, have you ever had those situations where it's just, and then what have you done to just allow yourself to let go?
I would say I haven't had that issue. That really depends upon individual's personality on how much they can, like, they want to micromanage, or how much they want to hold on to, and how much they can let go.
Yeah,
I, in fact, told my team several years ago, someday you guys will replace me, and I need to train you, but you
yeah,
need to be ready. I can't just, like, hand it off to somebody like that, right? Most likely. And so I keep trying to train them to be able to step into this role whenever the proper time comes, or the situation, like, so requires. Or, for example, my investors might say, okay, this is it, and for you. And I've told my investors, the day you feel you lose confidence in me and my ability to execute, you bring in somebody who can take this to the next level. What I want is everybody in this, like all the stakeholders, to be able to extract maximum value
yeah.
from this business model, right? Whether that's investors or the customers, or, like, or anybody, or my team members, right? So that your direct question has less been an issue for me. It's just making sure the team is ready to step in when the right time comes, which is, like, a better, I would say, challenge for all the CEOs.
Yeah, which is also trust, right? Like you've got to have the right team around you, and they can look good on paper, they can look good from an initial meeting or whatever, but then it's like bringing them in, like training them, being ready. What are you seeing in terms of leaders, like from when you were a leader, and rising through the ranks, what are you seeing about today's leaders that's different to when you were, back growing yourself as a leader? Are you seeing anything different? Are you noticing any trends or anything like that with today's future leaders?
Obviously, the leaders are more tech savvy. They're more hands-on with what different tools, especially AI tools, can do. And they are incorporating those tools in each part of the business process. So, for example, my team members today, they use generative AI for sales proposals to, make sure that the
Yeah.
emails are professional, right? To make sure that, let's say, the spreadsheets do not have any error. To have a good starting point for the PowerPoint presentations, to have the right terminology when they're writing journal papers and so on, right? So I would say all of those have been changes which have come into the leadership in the last, like, I would say, 1 year, yeah, 1 to 2 years, yeah.
Yeah, and I feel like leaders today, they're more focusing on purpose. They're wanting more like they don't want to just work like relentlessly. They want to ensure that there's more of a life included within work. I am seeing more and more of that, especially with the younger generations, because they look at us and like, gosh, all you do is work, 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 work. I want more than that. I want a life. I want to, have that healthy, what I call work-life flow, or life work flow, where it's work's important, but so is life. And I love seeing that. And I think we're only going to see more and more of that, as these leaders come through, because with the ability to leverage more of AI, leverage more tech, it takes away a lot of the low value tasks to be able to focus on the high value, but then also be able to have that, fulfillment that is not just work fulfilled, but life and work fulfilled. Like, what's your view on, do you think that's a strong point of view as well? Or
I would say you are spot on with the work-life balance, comment. It's very important for generations Gen Z, and it is, I
yeah,
would say, less important for Gen X and millennials, right? That's just my personal experience.
yeah, agree.
But I would say when you're doing a startup, and this might not gel with what you spoke, but when you're talking about a startup, you don't have the luxury of work-life balance. You
No,
have to do whatever it takes to make it a success. 1 out of 100, startups are successful. Probably 1 out of 1,000, I don't have the exact stats, but 1 out of 1,000, have a good exit, right? So that doesn't happen by itself. It takes a lot of hard work. Work beyond working hours. It takes you away from your family. It takes you away from loved ones. It takes, more than what you might be willing to put upfront when you're doing it. Now that might not be for everybody, and so different, personalities, different profile. People have different profiles and personalities. And so people who are ready to give more than they would normally do should probably step into the startup role, and others should probably get into more into a established company past Series C. That's just my personal opinion.
no, I
Some
think
people
it's
might
a
disagree.
really good point that you raise. I think that the burnout piece though, like there's this, when you're in a startup, and I'm in my own, and then I've been in previous where, it was relentless, and you're just continuously work, work, work. I think there's a need though for sustainable founders, startups to grow sustainably. There's got to be an element of recovery, active recovery. You cannot work 24/7 a day. So it's having the ability to find some time out to actually be able to get that fresh perspective, the clarity that you need, and so that it's not a constant effort, effort, effort. There's got to be ability to get into that flow state or the effortless piece. And I think that's what I see as really important. And I know at times I need to pull myself out of it too and go, hang on a second, you're not even thinking straight anymore. Step away, because as a startup, as a founder, you are, you're living and breathing it, but you also need to
So
get
when
that.
you,
Yeah.
yeah, Belinda, when you talk about sustainability, there are different ways of doing that. One obviously is counting the number of hours, right? But then the other is to have a mission, to have a social impact focus in your organization. And when you have a social impact focus and you draw people to that mission, which are like-minded, right? They are willing to give it more than what they otherwise would. a purely commercial company, let's say making a social media, like, game or something, right, might not have the same, I would say, stake in that
Yeah.
mission as, say, a company which is providing primary health care to the rural or tribal people, or people at the bottom of the pyramid, right? And so that mission helps you like get the right level of buy-in, and that's a different way of thinking about sustainability.
I love it.
Another Yeah. And another thing I would mention is just overall alignment within the team. One thing which we do for that alignment and to avoid burnout or to reduce burnout or to take care of burnout is every quarter, once a quarter, I take my team for trekking in Himalayas,
Oh,
right?
wow.
And yeah, 2 to 3 days, like, trip that gives them a fresh start. They feel very rejuvenated after that. It also is a very goal-setting thing where when you're trying to trek at like 14,000 feet, 15,000 feet or more, it's not an easy task, right? So you set a goal which requires both physical endurance as well as mental, like, resilience, and you do it, and which is different from your regular work. And so there are different ways to handle that work-life balance and sustainability and burnout. So I would say counting hours is not the only thing which you should look at.
No, I love it. No, I could not agree with you more. And I love hearing the way you align your team and integrating that, the treks and everything else you're talking about. And then social impact. It's such a good call out because, for so long it's just been hit your numbers, profitability, but yet you get this disengagement when you haven't got social impact. And yet your business is all around social impact, which takes me back to specifically around healthcare. What are you seeing as the biggest trends coming out of healthcare in the next however many, like let's say the next, now to 5 years? What are you seeing as going to be the big trends?
I would say the biggest one is the increasing adoption of AI, especially AI at the last mile, which would enable health workers to do more protocols at point of care so that they can go deeper and wider in low resource settings. And that's number one. Number two is increasing use of AI in diagnostics, and just more AI or non-AI based point of care diagnostics products. Then also increasing use of AI in a hospital setting. Those are some of the, like, big ones, right? And then I would say models which are less capital intensive would be a trend also. It's already been a trend where, for example, in primary healthcare space, initially it was all about having fixed clinics. And then people, like, moved from just having fixed clinics to a hybrid model where your fixed or mobile clinics are then paired with AI, telehealth and AI to have a online plus offline model. So increasingly, you would see more hybrid models and more use of technology and AI in those hybrid models, and being able to do more both preventive as well as primary at point of care settings. And then obviously increasing use of technology and AI in a hospital secondary care, like, setting. All of those are some of the trends I see.
Yeah, it's fascinating. This is such a random question. You're probably just going to be like, what? How did you come up with the name Sevamob? Like, where did that come from? And I always love to understand how the name or the brand came about. It's my brand and communications background.
Sure. So Seva is service in Hindi, and Mob is mobile, and that mobile can be via a mobile team, or mobile can be via using a mobile phone or a smartphone. And so by mixing the two words together, it's Seva Mob.
Oh, I
So
love it.
service via,
Yeah.
yeah.
And what's next for Sevamob? Like in terms of where you guys are at, it seems that you've done a lot of pivoting, but strategically, and you may not want to give away all your secrets, but what do you see as next? Obviously, you've done some pilots in different countries.
So
What,
first of all, from business model perspective, we are set. It's going to be a B2B, it's going to remain a B2B business model,
yeah,
which now we have been executing for 8+ years.
yeah.
And the core of the model will remain the same. But what we will do over the next 3 to 5 years is to expand the use of AI in that model, to first of all enable those nurses to do more protocols at point of care, for them to address the scarcity of physicians and specialists at the last mile in a lower source setting, and to be more productive in that setting. So right now we have 8 AI-based medical devices. You will see us rolling out more of those medical devices. And you would also see us adding additional features and additional medical conditions in those existing medical devices. So that's from a technology perspective, and from what the frontline health workers will do. You will also see us expanding to more countries in South Asia and Sub-Saharan Africa, especially via offering a bundle of services that I mentioned earlier. That bundle would be a technology platform with AI plus third-party point-of-care rapid kits, plus telehealth panel of specialists, which often is lacking in those other developing countries in the places that I mentioned to you. So that's our roadmap, and you'll see us expanding along those lines.
Yeah, Shelley, last question, and then I want to get a tip from you. But like, how do you keep your energy full? Like, you are just full of energy. Like, you've got this utmost focus, and I can feel the energy exuding out of you. How do you keep your cup full? How do you ensure that your energy is at the level it needs to be able to keep doing what you're doing day in, day out? And I know you probably
So,
mentioned
Valinda,
team,
honestly,
etc.
yeah, I mean, the first thing is, I mean, you have to love what you're doing. If you don't love what you're doing, then it doesn't, you can't maintain the same level of energy, right? And then you have to have the right people around you. If those people can keep you motivated, and be part of your journey, then that's really good. And third, you have to be physically, no, not just mentally, but you also have to physically fit. So I do 10Ks thrice a week. I do HIT routines every other day. Then I do treks. I've gone all the way until 20,500 feet.
Wow.
I did two back-to-back peaks of 20,300 in, I would say, in 1 week. And so just setting more goals, being physically and mentally fit to achieve those goals, that also is very important.
Yeah, I think about it from the interconnection of your mind, body, and soul, and having that all kind of aligned. It comes back to alignment, doesn't? What would be one piece of advice, a tip for anybody in startup world, startup founder, or or a team who is at the point of almost quitting and giving up? They know they need to pivot, but they're exhausted. They've been grinding for quite a while. What would be one piece of advice you would give anyone in that situation? Look at your smile.
That's a tough question and very different question. Normally, people just, as a last question, I just want you to tell me what, one piece of advice. You made it very complicated. So,
I
uh,
purposely made it complicated because I wanted to challenge you so that you would be like, because I'm throwing all these questions at you and you're like, bang, 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 bang. I'm like, I got to give him a challenging question. Yeah.
So first of all, I would say if you are at the point of quitting, talk to different stakeholders. Those stakeholders include your family, and those stakeholders include your team, and those stakeholders include your investors, and your customers. And figure out why it's not clicking. Is it not clicking because the core business model is not right? Is it not clicking because the team around you is not right? Or is it not clicking because the right funding model is not in place, right? If and just one of those, let's say the right funding model is not in place, then just keep grinding, you're just wasting your time. It's not going to work out, right? The right mix of team and funding and family support and friend support has to come into place. If you can make that formula, the magic formula, if you can arrive at that magic formula, please continue and try to pivot, evaluate, get feedback from all the different stakeholders of how you can change. But if that formula cannot work for you or cannot come into place for you, then maybe it's time to do something else. It's not necessary that you have to kill yourself doing the same startup for the next rest of your life. Maybe there's something different. Maybe you're not born to be a CEO, but you were born to be, let's say, a nice COO or a nice CTO and be part of somebody else's vision, part
Yeah.
of somebody else's journey, right? And maybe you can deliver more value to the entire value chain and to yourself and to your family, doing it that way. So I think a lot of trade-off is involved. I would never say that please keep doing this and keep trying this and keep trying that. No, I mean, you have to look at if you have the right formula or not.
Yeah, great answer. Thank you. See, it was a challenge, but look at you. You answered it really well. So, how do we find out more about you, Shelley? How do we find out about more of your insights, but also obviously, how do we find out more about the business, Sevamob?
Yep. So more about us is on sevamob.com. More about me you can find on LinkedIn, on my LinkedIn profile. And anything you want to know in terms of new news or anything about the company, it's also on our Facebook page, all of which you can access from sevamob.com, sevamob.com.
Thank you so much. I really appreciated your time. It's been a real privilege listening to you, and yeah, Seven Mob sounds like it's going to be like part of that continued frontier in healthcare, and what a space and place to be playing in at this point in time. It's yeah, it's going to be fascinating to watch the healthcare
And
industry.
Belinda, I would just like to add in the end that your questions are different. They're not cookie cutter questions, which I often hear from other podcast hosts. So good job of running this in a slightly different format of challenging your guests. That's really unique.
Thank you. I was wondering if you were like watching me at some points going, what is she doing? Like, but I think I was definitely, I love to ask a few questions, but you know what? It comes down to Shelley. It's my insight, it's my intuition because I'm listening, I'm actively listening to you. And then I'm like, okay, that's a question. It's pivoting. I'm constantly pivoting with my questions in my back to these fingers over here, that picture that you love. So Shelley, it's been a real privilege. Have a wonderful rest of your evening and yeah, have a great week ahead. Thank you.
Thanks, Belinda. Thanks for having me.
Thank you.